Hi, so basically the scenario for today is basically a middle-aged man who was basically an alcoholic and had got into the stage where he needed a transplant, but unfortunately he was actually refusing the treatment. So basically, what would you do if you were in this scenario and your patient was refusing to get the treatment that they needed? So I will first try to acknowledge the importance of this transplant, sort of to gather more information about the patient, understand why this treatment is important for them and their survival. I will then go on to ask why, trying to get the reasoning behind his decision to refuse the treatment. So this might be just to probably talk to him alone without any family members, without any sort of external factors that might influence his decision, and just have a one-on-one conversation, and sort of also look at give him the pros and the cons of the treatment. I think based off that, I will then go on to try and explain if he was scared, for example, to receive the transplant, or he feels like he's not worthy enough to receive the transplant. I would then go on to explain how this might be a second opportunity for him to change his life, and that he is more than worthy of receiving this liver as well. I would then go on to the case of consent and whether he is capable of making the decision. So I would ask, like, when was his last drink, because I know that there's a certain period that there's a cap to basically something about alcohol and being 6 months alcohol free, something like that. I need to read up more on that. But yes, is he capable enough to make the decision? Can he weigh up the risk? Can he retain the information? Can he communicate that back to me as well? I would then make sure I could ask him if it's okay if I could talk to his family, kind of see if it's okay to update them and sort of find a reason why, and whether they could talk to him as well. But ultimately it is the patient's choice, and if they decide to refuse this treatment, they have autonomy and they can decide to refuse the treatment if they are capable enough of making the decision, and we've talked to them and we've tried to not persuade them but given them everything to make an informed decision. Then we have to abide by the patient's autonomy, and I think that's what I would do in that scenario. And I'll just make sure that the patient is as comfortable as possible, and they don't sort of suffer for making that decision. It doesn't mean that you just leave the patient alone. It means that you try and give them the best possible care based on that decision. I will also look at alternative options that I could consider, and he could maybe accept rather than having a transplant. So yeah, that's how I would say it. Yeah, if he has capacity to make this decision. What did I say? Capacity. Oh, I don't know. I hope I said capacity, but that's kind of like what I would say. I don't know. Yeah, maybe the risks and the benefits associated with the surgery, but yeah, that's what I would say. I don't know.